I want us to take a moment to maybe introduce ourselves, allow, our audience to know who we are, what we do, and then we're going to dive deep into some things about infertility and its effect on mental health. Yes, I see some people giving us shout outs. Yes, Lorita, I see you. Right. Okay, guys. Well, let's start. Well, I guess I'm hosting, so I'm like guiding and facilitating. So my name is Edith Caballero. I'm a licensed therapist in Florida. I'm also the founder of Lotus Love Box, a holistic mental health care package company. We provide also sobriety gifts, God boxes, Reiki boxes, also spiritual gifts as well. And I have the pleasure of having Dr. Vicky Rodriguez and Eva Garro here. And we're going to talk about some really interesting stuff about infertility and effect on mental health. So let's start us off, Dr. Vicky. Tell us a little bit about you, and then we can Eva.
Yeah, absolutely. First, good afternoon. It's lovely to be here with you all. My name is Dr. Vicky Rodriguez. I'm a licensed psychologist here in the state of Florida, and I mainly work with clients who are experiencing reproductive challenges, perinatal concerns, mood challenges during pregnancy or postpartum, transitions to parenting, kind of all in that niche. And I'm really excited to be here.
Yay. We're excited to have you, Dr. Vicky. Dr. Vicky was like not a last minute addition, but I was like secretly hoping you would be message you about something. So I'm so excited to have you here.
Happy to be here. Thank you,
Tell us
Edith and
about
Emma.
you, Eva.
Yeah, so happy to have you all here. This is one of the topics that excites me the most, especially because it's Infertility Awareness Month, so I didn't want to end the month without doing this. So yeah, I'm Eva Garro, Eva Mariana. Some people call me Eva, some people call me Mar. Call me whatever you want. I'm a menstrual educator and counselor. So I see people one-on-one if they have any suspicious activity on their cycle, or they just want to get to know their cycle more, connect to it, and just know what it does and how it works. And to be able to know patterns and check if there's any imbalance that can be treated preventively before having to, go to other professionals. And then I also teach a natural fertility method, which is in the family of natural family planning or fertility awareness-based method called the symptothermal method, which I'll be talking more about it during the live. But yeah, it's basically a natural way to either avoid or achieve pregnancy. So very, very useful too.
Right.
So happy to be talking to you today and exploring the mental health side of things, because I think it's
Absolutely.
one of the most taboo things there are.
Oh, yes. Oh, yes. Yes, definitely. Ladies, I want to start off with some stats. I know you guys have some stats about like infertility, mental health. Can you guys share some of those stats with us?
Sure, I can go ahead and just share the one that's like the main one. And I think the most shocking one too. That is, according to the World Health Organization, about 1 in 6 people in the world experience infertility. So just to think about that, it's a big number. I don't know if Dr. Vicky has anything else to share in that.
Yeah, absolutely, absolutely. It's no small population, no small number, right? We know that 10 to 15% of couples experience infertility, primary infertility, and about even 11% of couples struggle with secondary infertility, right? So this is not just something that really impacts just one small subset of folks, right? We know also, and I think this is going to be a good topic for us today, is that there's a lot of misinformation or lack of information about fertility. We know that fertility, about a third of infertility cases are related to male factor infertility, a third to female factor infertility, and a third to both, right? So this is definitely a great place to make sure we're taking as holistic an approach as possible.
Yeah. I didn't know about those stats. Thank you for sharing them, Dr. Vicky. Yeah. And tell us a little bit, Dr. Vicky, on some effects on mental health, or maybe we can start with some common beliefs or misconceptions or myths, if that makes sense.
Sure. A big myth about pregnancy, I think that is common in a lot of cultural spaces, is this idea that becoming pregnant is really easy. and doesn't involve any effort or too much work on an individual's part. And that's something that many folks discover is not completely accurate because of this lack of education, because there are multiple factors that go into a person's fertility before we even start accessing treatment for fertility. A lot of different variables that get impacted by experiences of infertility, notably, which I hope I think we're getting to, is this idea that this is a very stressful, complex medical process, right? Yes, we always want to pay attention to our mind-body connection, and there's a significant amount of medical intervention that goes through somebody accessing infertility or for reproductive challenge treatment. So we know definitely shame and stigma come up pretty frequently for folks accessing fertility care. Feelings of confusion or uncertainty come up very commonly for folks. And also, I hear quite frequently, I would say from about 100% of my clients, this idea of thoughts like, why can't my body do what it's meant to do? This means I'm a failure. What's going on with me? And I think folks also, I guess, have trouble conceptualizing fertility experiences or infertility experiences as kind of a grief and loss experience and an incredibly stressful or traumatic experience. I would say that's kind of one of the biggest things that gets lost, I think, is just the incredible consuming nature of fertility and fertility care.
Yeah. I love what you mentioned about the shame, the stigma, and the accessibility to care. And it sounds like a lot of us can, a lot of, just individuals who've gone through this process have, shared those concerns as well. Yes. And I love that you also mentioned about the grief and loss, the grief period, because, you're thinking, okay, maybe I can't have a kid, or I can't have a child, or I don't have access to the right provider to help me through my care. And it just feels like individuals looking to, have children go through this roller coaster of emotions in the looking for the provider. What is wrong with me? Is there something wrong with me? Am I not worthy to have children? This is something that I should be doing naturally. So there's a lot of, beliefs, emotions, stigma, shame that comes up for sure. Yeah. Yeah.
Yeah, just wanted to add a little on that. I think the most important part is a preventive, as I was saying before, because that's the thing. Sometimes most of the issues can be not having intercourse in the right days, as simple as just knowing your exact fertile window, or if you're low on progesterone, or something that can be seen in an easy way, for example, with the symptothermal method or other natural methods, like fertility based. So yeah, it's just, to really empower patients to first do the research and really prevent before having, because most of the people I've seen that come to me regarding infertility is they don't know what's wrong with their cycle until they want to achieve pregnancy, and then all these things come like an avalanche of problems that could have been prevented in the first place. So yeah, very important to know that too. That sometimes it's easier than it looks, and also that it's not easy to get pregnant as we think, because we have a fear-based education most of the time, especially in the Hispanic, culture. But sometimes it is easier than it looks, and it's a matter of just knowing your body and your cycle and how it works.
Yeah. And I feel like what you're describing, Eva, is that prevention is key. And then if prevention is not, let's say, effective or helpful, or isn't giving us all the answers, this is where further access to care is needed. So yeah, that definitely makes sense. Dr. Vicky, from your experience, what are some of, I want to say, the common maybe trauma or traumatic experiences that you've noticed with your clients with this process of fertility or infertility?
Sure. Sure. Before I answer that question, I just want to, highlight again what Ms. Eva had said that, and I'm sorry to use kind of a combat related metaphor, but it's so important to be armed with accurate, good information about one's own body and one's own fertility process to really empower folks to make the best reproductive choices for themselves, right? So all of this information and service that our educators provide, so necessary, because we find so many times that there's just a wealth of information, baseline information, that just is not as accessible to some folks when they need it. Yeah, so in terms of experiences of trauma, loss, and stress, kind of along the fertility continuum, I really want to go back to that idea of grief and loss, right? You had come up with those questions of what does it mean if I can't do what my body's meant to do, right? Even if someone has been thinking their whole lives, oh, I would love to be a parent, I really want to have a child. Or even if they've thought, the last 6 months, I've really thought that I want to make this decision for myself and become a parent. Many times there's almost this grief of identity, right? What does it mean if I'm not going to be a parent, right? What does this say about my values? Or what do I do with if one of my values is parenting or expanding my family, right? So there's a lot of loss in the sense of what does this mean about me? What is my life going to look like? What if my life looks really different than what I imagined? And yeah, so that's kind of in terms of this idea of grief and loss and identity. Now we know with traumatic and stressful experiences that this is in the eye of the beholder, right? And so the event throughout the trajectory of someone's fertility journey may or may not be as important as how somebody is perceiving it or understanding it or interpreting it. And that's why trauma-informed care is so important, right? across the board. But for example, experiences that people experience as traumatic or stressful throughout this continuum. It's like I mentioned earlier, it's a heavily medicalized process, which is wonderful. We love our REI physicians that are helping in their infertility patients. And if someone is coming in with any kind of experience where interaction with the medical establishment or doctors or offices are difficult or stressful, that can certainly be a barrier to someone accessing treatment. Many times I think along the spectrum of somebody is doing, for example, in vitro fertilization or IVF, which is one of the treatments for infertility, and they lose embryos, right? So they may have embryos that are transferred and planted and then don't develop. People can kind of feel in this space of a no person's land, like, wow, I had this potential embryo that I wanted to use to bring home a baby, and this isn't part of my life right now, right? This isn't what happened. And what does grief look like when someone is saying, gosh, I longed for this child and I'm not bringing this child home, but I had that chance to do so. Wow. So that's kind of one of the big areas of trauma and stress that we see on the infertility continuum.
Yeah, definitely. I can see that. And I guess what came up for me as you were sharing that, Vicky, is how, I feel like women are waiting to, have children at a much older age when they're much more established. They're putting their careers, I don't want to say first, they're just prioritizing, their time. Mm-hmm. And for a lot of women, we're seeing that we're wanting to get, pregnant or start a family in our 30s, our early 40s even, and with that being said, just naturally, it sounds like there's going to be some, there are already people who struggle with the fertility aspect. And that's not even including individuals who already maybe struggle with their menstrual cycle, which is where EBA comes in.
Right.
They're having some, they experience PCOS or any other kind of symptom or syndrome. And I think, I feel like what I'm getting from this conversation is, like you said, Dr. Vicky, to be armed, right? To inform yourself, to seek the right help and guidance and education. And sometimes we don't find that in our own doctor's office. We don't get that from our own gynecologists sometimes, and that's unfortunate. So I love that, Eva's here because, she'll be able, to inform us if, we're having some doubts about our cycle and fertility and, kind of having certain, people and guidance to help us. Yeah.
Yeah, there's a big gap, unfortunately, between the medical community and this like just natural methods. It's just they are put in a box with all the other natural methods that don't really work. I mean, they work, but they have less effectiveness as the calendar or the rhythm method that was popular back in the day. I think it's just a lack of information and education, and that's where the gap comes, where it's it would be good for doctors as well if people knew more about their cycle in a way, because it would be easier to help them and treat them. But unfortunately, there are some other interests as well, and just the big pharmaceutical industry. But yeah, I love what you're all saying, and I think that's what we need, just to build more networks of professionals that do certain things, because one can't do everything alone. Like there's so much I could do, and then I have to refer you to someone else. And you might need a team of people. You might need someone to help you with your mental health, and aside, you might need a nutritionist, but then you might also need someone that teaches you about the cycle. So just putting it out there that it's just not like a, oh, do it yourself course and that's it. Like it takes sometimes an army, but if you really want to, and you're willing to do something for yourself, and because that's the thing, like you're transferring all that to your children. So even if you get pregnant, like what are you transferring to them? Like what are they gonna do when they grow up? You have to also teach them. If you don't have the information, the correct or the current information, the updated information, look for someone that does, and really just make that effort. And research. There's everything nowadays online, and just put some effort also into your own healing, and not and try to not look for a fast way out, just because sometimes we might go back to that now, like the desperation and hopelessness and all these myths that, oh, it's impossible to get pregnant after 40. Like, who says that? Like, it's not for everybody. That doesn't happen for everybody. So just, yeah, everybody's different, and just to really have that clear that everybody needs a different treatment,
Yeah.
and a different journey.
I love what you said. It feels like it's reinforcing the notion of meeting ourselves where we're at, right? And I love what you mentioned about it's a team effort, right? And trying to do this like by yourself, it's pretty hard and it's pretty stressful, and it does take a team. It does take a team. It takes your gynecologist. It takes maybe a menstrual educator. Maybe it takes a mental health professional. Like it takes a team to help you, navigate that. The same notion as like as it takes a village to raise a child, it takes a village to raise a mother too.
Mm-hmm.
And yourself and us, if that makes
Yeah, yeah. If I can add, I want to just again say how important that team-based approach is. If anyone can think back to their last primary care provider or women's exam appointment, there's about 1 billion things on the to-do list to get done in 15 minutes, right? And so this necessitates kind of really building spaces where there is evidence-based, scientifically accurate information for folks to access related to fertility, like Eva, you were saying, right? We sometimes have to go outside of the medical appointment in and of itself because of time.
sense. Yeah.
And sometimes
Definitely.
doctors don't even know that these methods exist, for example. So it's not their fault, or that they don't want to help you, but that's sometimes they just don't know that this exists. That's what I've come up against with, like, I've asked my own doctor, and she's like, I don't know this methods, you know. So it's just that's another thing. Just trying to really connect with professionals that are aware that this exists and that can point you in the right direction, even if they can't help you themselves.
Yeah, yeah, definitely. And ladies, what do you guys think about tools or resources or things that we give people to take away with them, or some takeaways for people? And I would obviously love to know, whoever's still on, maybe some things, or some, questions or comments, or maybe something that's come up for them.
One of my favorite websites is resolve.org. They have great information and it's very easy to understand. I feel like it's super user friendly and you can get almost anything you need there. So I would totally recommend that website, and probably Vicky has many more. And besides that, just talking about my own thing, like what I do, just start with getting to know yourself. I think that's the most important thing, because you can't manage what you don't know. So I think that would be the first step before even thinking about IVF or IUI or whatever it is. Please get to track your cycle if you don't. Um, get to if you can take a course like the symptothermal method, even better, because you'll get to know it in a very, very deep way, and you can flag if there's anything wrong that you can fix before having to spend thousands of dollars and a lot of time and a lot of energy and medications and all that. So just that, get to know yourself, self-knowledge, self-awareness, and yeah, get to know your cycle first before doing anything.
Yeah, thank you for that. It's so interesting because Vicky and I were we were going like this because Resolve organization that the last Self Care for a Cause event, which Dr. Vicky facilitated on self compassion.
Mm.
All the donations went to resolve.org.
Oh,
So
nice.
yeah,
Okay, cool.
Resolve.
Okay.
Yeah.
Yeah,
Mm.
I'm so glad you mentioned Resolve. So Resolve is the National Infertility Association. Great information, great again, scientifically accurate, evidence-based information for folks about fertility, right? Fertility, whether that's your menstrual cycle or um, any other kind of gynecological health concern or reproductive system health concern. Um, a few other resources that are important are the American Society for Reproductive Medicine, right? So this is the body that um, does research and puts out information about infertility, fertility treatment, as well as Postpartum Support International. So that is an organization for folks managing perinatal concerns, and that includes fertility challenges. So I think that if someone's going to do one thing, access one intervention, that starting with a support group is a great idea. I think a theme of our live today so far has been community, and shared knowledge. And we know that support groups are effective in helping folks cope with stress like infertility or other perinatal concerns. I love, Eva, that you talked about knowing oneself, having that self-awareness. One thing that I think can be often overlooked is that the person going through the fertility challenge, the fertility treatment experience, is the expert on their own body and their lived experience in their body. And so kind of that, while the providers, the REIs, the GYNs are absolutely bringing their knowledge and expertise about human physiology and endocrinology, the client or patient is just as important, right? Is such an important member of the team because they come in with their own expertise of their body. So I would absolutely recommend, for anyone managing fertility stress, searching for support groups, linking up with a counselor, therapist, psychologist, even if you're unsure, or just starting to think about what fertility might look like for you, right? We think about it in terms of, oh, there's a problem, then I go to therapy or I meet with a therapist or a
Mm-hmm.
counselor. But we can really work with folks that are just in the beginning stages of making decisions about fertility. It's just as
Mm-hmm.
important.
Yeah. One thing I want to know, as a trauma therapist myself, is that sometimes for some folks it could be difficult to feel embodied, right? When we talk about like you're the expert of your body, but sometimes when people have felt disembodied, or disconnected or dissociated from their bodies because of their experiences in their lives, um, it is sometimes I feel like what I hear from clients is that they're not aware, they're not able to make the connection sometimes.
Mm.
And I think for mental health care and somatic therapies, yoga or whatever, practice that can help you feel embodied is helpful, especially if you have felt disconnected or disembodied due to some of the experiences that you've had in your life. And that could be just like you said, Dr. Vicky, one of the first steps, right? Seeking mental health, seeking counseling, getting to know thyself, maybe talking to Eva, getting to know thy menstrual cycle, thy cycle, and what that looks like. It's funny because when Eva and I last went to lunch, we were talking about like the different cycles and the phases that we go through, right? And it's like, yes, this is how we feel in our luteal phase. This is how we feel in our ovulation phase. And I've actually had to tell my clients and educate them about their cycle. And it's like, well, they start diagnosing themselves. Oh, I'm bipolar. I feel like I'm bipolar because sometimes in the month I feel really like joyful and happy. And then sometimes I'm really upset and tearful and I'm sensitive. And I'm like, are you tracking your cycle? So even something simple as that, just again, getting
Yeah.
yourself, getting to know, the fluctuations that happen within our own bodies. Number one, so mental health care, getting to our menstrual cycle. Eva's here to help us with that as well. Um, and just, another thing that was just coming up for me, as I mentioned to you ladies, is that a lot of us are planning or family planning at a later age. Me, myself, I'm thinking and I'm kind of just considering and I'm in that process myself. And it's very nerve wracking. I was talking to Eva. I'm like, I don't know if I can have kids or not. Like I've sort of been trying, but I haven't been really. And I know I have a consultation with Eva's group, coaching, because she's going to coach me a little bit more on my menstrual cycle and how to make sure to, find my highest fertility window and all of that. But again, that fear can also come with the unknown, like you don't know. um and it's getting to know thyself through either therapy, somatic practices, through Eva's coaching program, to you as well, Dr. BK. I'm giving you a shout out because this is a community that you work with, right? So you have a lot of clients that you see, like you said, with perinatal concerns, infertility,
Mm-hmm.
postpartum.
Mm-hmm. Mm-hmm. Yeah, yeah. Some of my favorite clients show up and say to me, I'm not sure if I want to expand my family more than it is now.
Mhm.
And that's a beautiful conversation to have, right? Really, really great way to connect to one's own values, one's own interests, one's own future plans. And so absolutely, right?
And
Absolutely.
simple thermal can help with that too,
Absolutely.
because if you don't want to have any more, if you already have your kids and you don't want to have any more,
Right.
you can also use that as a natural tool to avoid pregnancy. So yeah, and just adding to what Edith was saying, I just feel like we're used to go against our cycle, not with it. You're
Mhm.
supposed to take advantage of its own energies and its different phases, that they're there for a reason, for us to use that energy on to feel better and to do more, to be more productive even. And we tend to do the opposite. We tend to live as men, and we just go every day doing the same, when the truth is we have different energy levels throughout the cycle and we have different hormones playing in our body. So yeah, just very important what you were saying about that sometimes we might think it's something worse, and it comes down to that, as simple as knowing where you're at in your cycle. um and also just wanted to add lastly that I think it's also Vicky could just add on this, but I think it's also important to look into your past and your ancestors, because you might be carrying some of that trauma as well. Ask, if you can, ask your parents about your birth, ask your grandma if you still have grandparents, really like dig in and try to look for, how was my own birth? What was my mother's trauma with birth? Because some of those things we don't even think about them, and they're also important when you're trying to conceive yourself. Some of those ancestral things that we're carrying, and we might not, look into them, and then there might be something blocking our fertility as well. I'm not saying that's the only thing, but that's definitely important. It's at least what I've seen with my own clients. So just, inviting us to take a holistic view, as we were saying at the beginning. Look into all of those things as well.
I love that you mentioned that piece, Eva, because we hadn't mentioned the piece of intergenerational trauma and how specific traumas can be passed down to us, and it could even be, not to say that's the only issue or whatever, but it's something to look at, maybe to explore in therapy about our own story of what our mother went through, or if there's any even miscarriages in the family. I know that my grandma
Mm-hmm.
miscarriages, and that's something that they carried with them. The stories, the detailed inner bones story, genetic stories that are in us, right? And
Epigenetics, the magic of epigenetics.
yeah,
Yeah.
definitely.
Yeah, I want to shout out one of Eva's posts that I can't remember which day it was, but it was like a 3-step things to do before getting pregnant. And the third one was healing your inner, doing kind of inner child work. And I think that really connects with the message of how mental health in general is very important, and especially important during pregnancy, right? During this fertility period, because we know good positive mental health in pregnancy is correlated with good positive mental health postpartum, right? So
Mm-hmm.
this is why we need to pay attention to mental health during this time, right? Also, I never mean to be like minimizing in some kind of way, but when we look through the lens of stressful experience, right, and incredibly huge physiological shifts, right, the fertility and pregnancy period is incredibly stressful, right? And so we want to make sure that our pregnant folks or our people that are thinking about pregnancy are taking really, really good care of their brains.
Yeah, definitely makes 100% sense. All right, ladies. Any other closing thoughts? Anything that you can think of that we want to close with or share with before we start wrapping up?
Um, sure, I can close first. So what I was saying before, and then, I mean, it all comes down to get to know your cycle. That's what I do. That's what I teach. So reach out to me if you have anything you want to look into, more into detail, or just, even just to check how you're doing in general. Even if you don't want to get pregnant or you're not looking at that at the moment, I totally recommend you getting to know your cycle. Just for general health, it's the fifth vital sign. That's how they call it. So you can know a lot of what's going on in your body just by looking at your cycle every month. So it's very, very important. And also just, a big like disclaimer on the apps that people usually use. They're great for just tracking like without knowing much more. But I do want to say just be careful. Don't rely on them as, birth control form or method, because those are mostly predictive. So I really invite you to get to know your cycle more and deeper, so you can make really like good decisions about if you do want to use it for birth control purposes. You have to learn some rules for it to be effective, and have the 99.6 effectiveness that it has. So yeah, just be careful with those predictive apps, because sometimes they are predictive in the end. So they might be close, but they might not give you the exact thing that you're looking for. And then also that there's technology too, besides what I teach that's completely natural, we do have some tools to add that can help us know more things. For example, I use the Mira. It's a fertility tracker, which is very, very cool. I was just having a meeting with them today, and it's a great tool to assess more things. It's like a lab test at home that you can do. So just to know that there are so many things out there that we might not even know they exist. So support groups are great for this. You might get, these recommendations or other people that are using these gadgets, and you never know. One of these things might help you more than you know. So Yeah, I have a special discount, so I'll be posting it on my stories after this live. So if you're any of you are interested in checking out Mira, I have a good discount for you also. That's
And
it.
that's a blood work test to check your
Mm,
fertility.
No, it's a
Oh,
urine test that you
okay.
do every day, and it's very, very easy. And they have an amazing app, an amazing support system, and coaches that can guide you through your results and all that. So it's very, very cool.
Awesome. Thank you, Eva.
Yeah.
Dr. Closing.
Yeah. Yeah. To add on to that, I think it's important to remember, we want to get away from this idea of fear-based learning or fear-based information around fertility. And it's never too early to inquire about fertility, right? Everyone has the right at any point to ask their care provider about an assessment for fertility. Um, so I think it's funny, we're doing this Instagram live, and I think that a big um, troubling piece that comes up a lot with my clients related to fertility is social media, right? And so
Mm,
really, in and of itself, fertility challenges can just be so deeply isolating, and really many area domain of the world imposes a certain right experience of parenthood, and as we know, there are 1,000 different ways to be a good parent and 1,000 different ways just to be a parent in general. And so really looking at being really judicious in consumption of images, social media, that are not serving us. Really, I'm a big stickler on anything that is shame inducing. We don't want to go near, right? So if someone is telling me that they're scrolling and it's making them feel shame versus connection versus empowerment, I can't co-sign on that, right? We need to get rid of that. That's not helpful for our minds. So that's kind of one of the big pieces that I'm sitting with is just how, um, this that we can really, as a community, put out images of a certain kind of parenthood to aspire to or to look forward to have that, may be damaging to folks when they don't see themselves reflected in that. Um, yeah, so I wanted to add that. Yeah.
and
Very important.
how can you, Dr. Vicky, if someone's interested in your services and your
Yes. Yeah, absolutely. So I am accepting clients that are Florida residents. So folks can reach out to me through my website, VickyRodriguezPhD.com. I'm also on Psychology Today and can be reached that way. Or you can also give me a call at 786-728-9908.
yeah, amazing.
Yeah. Yeah.
All right, so this wraps up our live. And I guess my closing, I have so many takeaways. Like I have writing
We'll
them.
need a part two.
Yes, my takeaway is community. Be informed, know thyself, seek help. It takes a team, right? This is not something that you're going to write alone. It takes a team. Um, and yeah, thank you guys for being here. Again, my name is Edith. I'm from Lotus Soapbox, and we curate mental health care packages. So if you do know someone who's going through either miscarriages or experienced miscarriages, or is going through an infertility journey, mental health, anxiety, depression, we curate mental health care packages for
And
individuals going.
they're so beautiful. I think that they would be so helpful for people that are going through this
For sure.
process.
Thank you guys, and thank you those who joined us. I'm not sure if
Thank
anyone
you
on the
all.
who's still.
Yeah, thank you all for being here today.
Let me just see if there are any questions posted. Thank you, thank you, thank you. For those who are still with us, does anyone have any questions or comments? And if you do, we'll stick here for like a minute more. But if not, you can contact directly with Eva.